Good morning, everyone, and welcome. Today, I'm excited to introduce our presentation on mobility and immobility. This is part of our first-year BSc Nursing course, focusing on the foundational concepts that are essential for nursing practice. We will be exploring the key principles outlined in the KUHS syllabus related to mobility. Over the course of this presentation, we'll cover what mobility and immobility mean, their significance in patient care, and how we, as nurses, can effectively address these issues. Let's get started. Let's start by looking at some key terms. Mobility refers to the ability to move freely and purposefully. It's about being able to get around and perform daily activities with ease. On the other hand, immobility is the inability to move independently, which can significantly impact a person's quality of life. Maintaining mobility is absolutely vital for overall health because it supports independence, enhances physical and mental well-being, and helps prevent complications that can arise from inactivity. As we explore this theme further, keep in mind that preserving mobility is a cornerstone of healthy aging and good quality of life. Let's talk about the importance of mobility. When we promote movement, it helps improve circulation, which is essential for delivering nutrients and oxygen to our tissues. Staying mobile also plays a key role in maintaining muscle strength and flexibility, preventing those muscles from weakening or stiffening over time. Additionally, good mobility helps prevent common issues like pressure sores and constipation by encouraging regular movement and activity. Beyond the physical benefits, mobility also boosts mental well-being and independence, making daily activities easier and more enjoyable. Overall, keeping active not only supports our physical health, but also enhances our quality of life and sense of autonomy. Let's take a look at the causes of immobility. First, there are physical factors, which include injuries, surgeries, and paralysis. These are often direct results of medical conditions or accidents that limit a person's ability to move. Then, we have psychological factors like depression and fear of falling. These mental and emotional states can significantly influence a person's activity level, sometimes even more than physical issues. Finally, environmental factors also play a big role. For example, the use of restraints or a lack of assistance can create barriers to mobility. Recognizing these causes is crucial because addressing them can greatly improve a patient's quality of life and help prevent further complications. Remember, immobility isn't just a physical problem. It's often a complex interplay of physical, psychological, and environmental factors. Now, let's take a closer look at the effects of immobility on the body. When a person is immobile, one of the first systems affected is the musculoskeletal system. You might notice muscle atrophy, which means the muscles weaken and shrink because they're not being used, and joint stiffness, making movement more difficult over time. Moving on to the cardiovascular system, immobility can lead to hypotension or low blood pressure and venous stasis, where blood pools in the veins. This pooling increases the risk of blood clots and other complications. In the respiratory system, one significant concern is hypostatic pneumonia. This occurs when lung secretions aren't cleared properly because of reduced movement, leading to infection. For the gastrointestinal system, constipation is a common issue because decreased activity slows down digestion and bowel movements. In the urinary system, we see stasis, which is urine remaining in the bladder longer than it should, increasing the risk of urinary infections. The integumentary system, your skin, can develop pressure ulcers or pressure sores because prolonged pressure on certain areas reduces blood flow, causing tissue damage. Psychologically, immobility can also lead to depression. The lack of activity and social interaction can negatively affect mental health and overall well-being. Understanding these effects helps us recognize the importance of mobility for maintaining overall health and preventing these complications. Now, let's talk about range of motion exercises, or ROM exercises. These involve moving a joint through its full range, which means gently stretching it to its maximum extent without causing pain. The main purposes of these exercises are to help maintain joint mobility, which is essential for overall movement and function. They also play a key role in preventing contractures, which are permanent shortenings of muscles or tendons that can limit movement. Additionally, ROM exercises promote healthy circulation and help maintain muscle tone, both of which are vital for overall health and recovery. Incorporating these exercises into a routine supports the overall goal of preserving mobility and preventing complications, especially during periods of limited activity. So, in essence, ROM exercises are a simple but powerful tool to help keep joints healthy and functional. Now, let's take a look at the different types of ROM exercises. First, we have active ROM, which is performed entirely by the patient. This means the patient moves their own joints through the range of motion without assistance. It's a great way to maintain muscle strength and joint flexibility independently. Next is passive ROM, where the nurse or caregiver moves the patient's limb for them. This is especially helpful if the patient is unable to move on their own due to weakness or injury. It helps prevent joint stiffness and maintains mobility. Then we have active assistive ROM, which is a combination of both. In this case, the patient actively moves the joint, but the nurse also assists as needed. This approach encourages patient participation while providing support to ensure the movement is smooth and within safe limits. Understanding these types is essential because each serves different patient needs and plays a vital role in recovery and maintaining joint health. Tailoring the exercise type to the patient's condition is key to effective rehabilitation and overall care. Now, let's talk about the principles of ROM, or range of motion exercises. First, it's important to understand the procedure. Always support the joints you're working on to prevent any unnecessary strain or injury. When moving the joint, do so slowly and gently. This helps avoid discomfort and ensures safe progress. If you or the patient experience any pain during the movement, stop immediately. Pushing through pain can cause damage and set back recovery. It's recommended to perform these exercises 3 to 5 times, ideally twice a day. Consistency is key to maintaining or improving joint flexibility. Also, always ensure privacy during these exercises to make the patient feel comfortable and secure. Remember, respecting privacy fosters trust and encourages cooperation, which is essential for effective therapy. By following these principles, you're supporting the joints effectively and safely, helping to achieve the best possible outcomes in recovery and mobility. Now let's take a closer look at the major joints and their movements. Starting with the neck, it primarily allows for flexion, which is bending forward, extension, which is tilting the head back, and rotation, meaning turning the head side to side. These movements are essential for basic daily functions like looking around or nodding. Moving to the shoulder, this joint is quite versatile, enabling abduction, raising the arm away from the body, and rotation, which includes turning the arm inward or outward. These movements are key for reaching and lifting tasks. Next, the elbow primarily allows for flexion, or bending the arm, and extension, which straightens it out. This movement is fundamental for activities like lifting objects or pushing. The wrist and fingers work together with flexion and extension as well. Flexion involves bending the wrist or fingers, while extension straightens them. These motions are critical for grasping, writing, or manipulating objects. When we look at the hip, knee, and ankle, they all share similar movements, flexion and extension. Flexion involves bending at the joint, like lifting the leg or bending the knee, while extension straightens it, such as standing up straight. Finally, the toes also perform flexion and extension, which are important for maintaining balance and walking efficiently. Connecting all of this to the overall theme, understanding these joints and their movements helps us appreciate how our body moves seamlessly in everyday activities, and it's fundamental for understanding human anatomy and motion. When assisting a patient in movement, the first thing I always do is assess their ability to move safely and comfortably. This helps me understand their current strength, balance, and any limitations they might have. Once I have a clear picture, I focus on using proper body mechanics myself, keeping my back straight, bending at the hips and knees, and avoiding twisting, to protect both myself and the patient. Encouraging independence is also key. I want to support and empower the patient to do as much as they can on their own, which promotes their confidence and recovery. Of course, I also provide assistive devices when needed, like walkers or grab bars, to make movement safer and easier. Safety is always my top priority. I make sure the environment is clear of obstacles, secure any equipment, and communicate clearly throughout the process. By combining these strategies, I help the patient move safely, maintain their dignity, and support their overall well-being, which aligns with our goal of providing compassionate, effective care. Now, let's talk about turning and logrolling, which are essential techniques for patient repositioning. Turning involves repositioning the patient every 2 hours to prevent pressure sores and promote comfort. It's a routine part of patient care that helps ensure proper circulation and skin integrity. Logrolling, on the other hand, is a slightly more complex method where we move the patient as one single unit. This technique is especially important when dealing with patients who have spinal injuries or have undergone spinal surgery. Moving them as a whole helps maintain spinal alignment and reduces the risk of additional injury. To perform logrolling safely and effectively, we typically need 2 to 3 nurses working together. This teamwork ensures the patient is moved smoothly and securely, minimizing discomfort and preventing any accidental injury. Overall, both turning and logrolling are vital skills in maintaining patient safety and promoting healing, particularly in those with special conditions like spinal injuries. Remember, the key is to always prioritize gentle, coordinated movements and proper support. When changing the position of a helpless patient, it's essential to prioritize their safety and comfort throughout the process. First, always explain what you're about to do and ensure their privacy is maintained, so they feel respected and secure. Using a draw sheet can make repositioning easier and reduce friction on their skin. Support the head, neck, and limbs carefully to prevent any injury or discomfort. There are several positions we might use, depending on the patient's needs, such as supine, lateral, Fowler's, or prone. Each position serves different purposes, so understanding when and how to use them is key. Remember to keep the call bell nearby so the patient can easily call for assistance if needed. Overall, gentle handling, clear communication, and safety are the cornerstones when changing a patient's position, helping to prevent injuries and promote their well-being. Now, let's talk about how to safely transfer a patient from the bed to a chair, wheelchair, or stretcher. First, always make sure to lock the wheels of the chair or wheelchair before beginning the transfer. This is crucial to prevent any movement that could cause a fall. Next, use a transfer belt if it's appropriate for the patient. The transfer belt provides a secure grip and helps support the patient during the move. When doing this, support the weak side of the patient to help maintain their balance and stability. It's also important to encourage assistance whenever possible. Whether it's from the patient, family members, or other staff, assistance can greatly improve safety and ease the transfer process. Remember, the goal is to make the transfer as smooth and safe as possible, minimizing discomfort and risk for both the patient and caregiver. Let's talk about assistive devices that can really make a difference in patient mobility. First, we have the walker, which is especially helpful for patients with an unsteady gait. It provides stability and support, reducing the risk of falls. Next is the cane, which should be used on the strong side of the body to help improve balance and ease walking. Then there are crutches, which are typically used for patients with leg weakness or injury. They help support weight and offload pressure from the leg. Finally, for patients who are more dependent and unable to walk or move easily, wheelchairs and stretchers are essential. They ensure safe transport and comfort when mobility is severely limited. Understanding these devices and their proper use is vital to promoting safety and independence for our patients. Let's talk about patient education and why it's so vital in your recovery. First, the importance of movement cannot be overstated. Gentle, regular movement helps keep your joints flexible and muscles strong, which is key to healing and preventing complications. Performing range of motion exercises at home is something you should do consistently. These exercises are simple but effective in maintaining joint function and reducing stiffness. Remember, staying active within your limits is crucial. Fall prevention is another critical aspect. Making your environment safe, like removing tripping hazards and using proper lighting, can significantly reduce your risk of falls, which can be very serious after surgery. Using your devices properly is also essential. Whether it's crutches, walkers, or any assistive devices, proper use ensures safety and supports your mobility without causing harm. And finally, always report any pain or swelling to your healthcare team. These could be signs of issues that need attention. Addressing these early helps prevent complications and keeps you on the right track toward recovery. Overall, staying engaged with your care through movement, safe device use, and open communication plays a big role in a smooth and successful healing process. Now, let's talk about the crucial role of the nurse in mobility care. First, assessing and planning for the patient's mobility needs is essential. This means evaluating their current abilities, potential risks, and creating a tailored plan to promote safe movement and prevent complications. Speaking of complications, preventing issues like pressure ulcers, muscle atrophy, or blood clots is a key responsibility. We need to be proactive in implementing interventions that minimize these risks. Additionally, providing psychological support is just as important. Mobility challenges can affect a patient's mental health, so offering encouragement and emotional reassurance helps boost their confidence and motivation. Lastly, educating both the patient and their family about mobility exercises, safety precautions, and the importance of movement empowers them to participate actively in the recovery process. All these elements are interconnected and highlight how nurses play a vital role not just in physical care, but also in supporting overall well-being. Remember, our goal is to promote mobility, prevent setbacks, and foster a positive recovery environment. Now, let's talk about the importance of documentation during the exercise session. It's essential to record several key aspects to ensure we track progress accurately. First, we note the type of exercise performed, so we know what activity was done. Next, we record the level of assistance required, which helps us understand the patient's independence and any changes over time. We also pay attention to their tolerance, how well they tolerated the exercise without discomfort or fatigue. Additionally, it's crucial to document any abnormalities or complaints the patient might have experienced. These details give us a comprehensive picture of their response to the activity and guide future adjustments. Overall, thorough documentation is vital because it not only tracks progress, but also ensures safety and helps tailor the program to each individual's needs. Remember, consistent recording ties back to our goal of providing personalized, effective care. Let's take a moment to summarize what we've covered. As we've seen, mobility is truly essential for overall well-being. It affects not just physical health, but also mental and emotional wellness. Nurses, in particular, play a crucial role in encouraging and supporting movement, helping patients stay active and engaged. Regular activity isn't just about staying fit. It's a key factor in preventing a range of complications, especially in vulnerable populations. By promoting movement, we can improve recovery times, reduce the risk of infections, and enhance quality of life. So, overall, ensuring mobility is a vital part of holistic patient care, and nurses are at the forefront of making that happen. Now, moving on to our references, I want to highlight a few key sources that have been instrumental in shaping this presentation. First, we have Cozier and Erb's Fundamentals of Nursing, which is a comprehensive textbook that covers the essential principles and practices in nursing. It's widely respected and often used as a foundational resource. Next is Potter and Perry's Fundamentals of Nursing, another cornerstone text that emphasizes clinical skills, patient care, and the ethical aspects of nursing practice. Both of these books provide valuable insights that underpin our understanding of nursing fundamentals. Additionally, I've included the KUHS Nursing Foundation's syllabus, which offers a structured curriculum aligned with current educational standards and helps ensure that our learning is consistent and up to date with institutional requirements. These references aren't just sources for factual information. They reflect the core concepts and best practices we've discussed throughout this presentation. They serve as reliable guides to deepen your understanding and support your ongoing learning journey in nursing.